Minister of Home Affairs Honorable Benn says Guyana must ramp up its effort to eliminate trafficking in persons, even as the country tackles the COVID-19 pandemic. Minister Benn joined Minister of Human Services and Social Security Honorable Dr. Vinji Prasad at the launch on Monday of the 2021 to 2023 National Action Plan for Trafficking in Persons.
We have to increase our operations. We have to increase our prosecution rates going forward. In spite of COVID, we have to do this or we will be swamped. We will fail in it if we don't have a response in this new action plan with respect to these issues.
Minister Benn says the influx of Venezuelans here has created avenues for such exploitation, and systems must be in place to ensure their safety.
We need to empathize with them. We need to continue to put the human welfare issues and the support services for them so that they can join our Guyanese family. That is what we are about. So the challenge for us, strategically and tactically, is to make sure those who come here can come here without joining the corruption flow, becoming corrupted, becoming exploited sexually and economically, and the other ways in which these things occur.
Dr. Prasad says this modern-day slavery strips a person of their basic rights, leaving them at the mercy of the trafficker.
As we continue to work towards the maintenance of our Tier 1 status, I want to say that we must, even so, overemphasize the importance of training. And through the Ministry of Human Services and Social Security, we will be placing much emphasis on training in anti-tip for forestry officers, police ranks, customs officers, community policing groups, local government authorities, accounts and administrative staff of the Ministry of Human Services and Social Security, transport operators, members of civil society. This will be done in conjunction with the Ministry of Home Affairs.
In 2004, the government ratified the United Nations Convention on Transnational Crime and its supporting instrument, the Protocol to Prevent and Suppress TIP, especially among women and children. This paved the way for the combating of the TIP Act No. 2 of 2005.